Hi, Roisin. Thanks for joining me this afternoon. As you know, I'm Paula McLaren. I'm the Senior Advisor leading the review of advanced practice for the NMC. If you don't mind, I'll hand over to you just to let you introduce yourself, if that's okay.
Yeah, absolutely. So thank you for the invite. My name is Roisin Devlin. I'm Assistant Director of Nursing in the Southeastern Trust, and my responsibilities are regulation, workforce planning, education and development.
That's brilliant. It's really great to have you with us and hopefully to shed some light on the work we've been doing, and particularly thinking about the role and the reach that you have in Northern Ireland and what the work means to you and your professions and also the public. So that's great. Um, I wonder, Roisin, if you could just tell us a bit about yourself. I know you've mentioned your role, but perhaps a little bit about your career and what's led you here and how you've been involved thus far in the review of advanced practice.
Yeah, absolutely. So I started off in plastic surgery for about 2.5 years on temporary contracts, but had always wanted to work within the emergency department. So, about 2.5 years after qualifying, I got a post within an emergency department and I stayed there for, I think, 24 years in total, not in the one emergency department. I moved around a few and I undertook my specialist practice in emergency care, which allowed me then to operate as an emergency nurse practitioner, and did my prescribing as well. And actually, I wanted to be an advanced nurse practitioner. That's where I thought I wanted to be. Um, but I had the opportunity to step out into NIPEC, which is the Northern Ireland Practice Education Council, and look at developing a career framework for emergency nursing. And while I was out doing that, I had an opportunity then to be seconded back into the trust into a temporary workforce role, which I did for about 10 months. And when I went back to the emergency department, my focus had probably changed off a clinical role, and a lead nurse post came up. It was the first lead nurse in the emergency department. So I applied and I got that job, which I did for about 4 to 5 years, and then a clinical manager post over unscheduled care, and then sidestep back into workforce planning and have been in post as the assistant director for 3 years now, 3 years coming in. But whenever I was an emergency nurse practitioner during that time, I sat on the Northern Ireland RCM board for about 8 years, and was also steering group member of the Emergency Care Association. And at that time, it was when Northern Ireland were developing their advanced practice framework. So I was asked as part of the RCN to sit on that group and help develop that framework. Now, that was a number of years ago. So I did that. And then with my role in the emergency department, I was involved in the operationalising of an advanced nurse practitioner course in the University of Ulster in Northern Ireland. And then part of my role now is education commissioning. So postgraduate commissioning for staff, which again would then be involved in advanced nursing practice and numbers and types of advanced nurses that we would need across Northern Ireland.
Brilliant. Thank you so much for sharing that. So, I mean, it really highlights the kind of different roles and expertise and experience that you bring, and I really hope we can bring out some of that in the conversation that we have this afternoon. But that's really helpful. Thank you. So, um, just wanted to pick up on the advanced practice framework in Northern Ireland currently is for nurses only. Is that right?
It is at the moment. Now there has been moves this year to develop an advanced practice course that would be multidisciplinary, but initially it was advanced nursing practice, and NIPEC is for nursing and midwifery. So
Mm,
that's why that was developed,
mm.
particularly for nurses and midwives.
Yeah, that's really helpful to understand that because yeah, it is other professionals who are taking on these advanced practice roles as well.
Hmm.
So it is growing, and we know that each country in the UK does want to grow the advanced practice workforce. So it's quite an exciting time, really, isn't it?
It absolutely is, yeah. And I suppose Northern Ireland was very different because whenever I was involved in the discussions at a national level, being part of the Emergency Care Association, very much ED led the way on
Mm,
advanced practice initially. And it was slightly different in that people would be seconded maybe 1 or 2 days a week to do their course,
mm,
and then at the end of it would move into the role. Northern Ireland is different in that we have 4 nurses seconded people out full time for two
mhm,
years to one, complete their course, and two, complete all of their practice placements. So it's very different. Than people doing it as we would probably have done our degree level specialist practice.
mm.
That would mimic the rest of the UK, whereas Northern Ireland have seconded people out full time for 2 years to complete the advanced nursing practice course.
That's helpful. And I wonder, and you might not know the answer to this question, so and that's fine. But how many advanced practitioners do you think you've got working where you are now?
In the Southeastern Trust, I can tell you
Yeah.
that in just about 2 minutes. I'll be able
Sorry,
to
putting
pull
you
it
on the
up.
spot.
No, no, you're fine. We do have it because we actually have a, um, an advanced nursing practice forum that meets regularly. So I'm just trying to find our exact numbers. We can talk on about something else while I look it up.
That's all right. And is the role kind of increasing in primary care as well in Northern Ireland?
Yeah, so there definitely is. You can see that there's an increase in numbers, and it really is being supported in primary care, and people looking to develop that role. We actually have a new initiative, hospital at home, that is being
Okay.
rolled out. One of the key roles that's being looked at that is around advanced nurse practitioners being available to go into people's houses as well.
Yeah, that's really interesting. And of course we know that there's a focus on kind of, moving care from the acute sector into primary care. So it makes sense, doesn't it, that the advanced practice workforce, particularly within primary care in the preventative sector, is going to grow.
Absolutely, absolutely. I'm just trying.
Don't worry.
No,
So
no, I do have a paper, but I might need to just do a bit of a manual count. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, approximately 35.
okay, and is that number growing within your within the southeast as well?
It is this the slight challenge, not the slight challenge, the huge challenge that we have is it- so we have an education commissioning cycle,
Mm,
where we are allocated money for courses. Um, the issue for us around advanced practice is that the commissioning cycle will cover the fees of somebody being seconded for 2 years to do the course. However, there is no funding for the backfill of their role, and there is no funding then for the uplift to an 8A. So that is, especially in these financial times, very, very challenging to be able to, uh, I suppose, backfill people
mm,
or create roles. Now, if we look towards maybe doing a funding model that is not specifically nursing or medical and goes
mm,
across, that may work better. But at
mm,
this moment in time, we're looking to convert nursing posts into advanced nurse practitioner posts with the inability to backfill. So if it was somebody, for example, that might be an award sister post,
mm,
or a specialist nurse post, we would lose that post unless we're able to identify another funding stream. So I think if that issue was resolved, we would
mm.
certainly see probably an even higher uptake in advanced nurse practitioners.
Yeah, it's really interesting, and it shows the complexity because we know that we hear that this is a real opportunity for career progression for nurses and midwives. But you're absolutely right. Every country has different kind of workforce commissioning processes and different ways of doing things, which add to the complexity, doesn't it, of
Absolutely.
growing the advanced practice workforce. You've you've probably led us in into the next question nicely. You started talking about some of the challenges, but I just
Hmm.
wondered, specifically thinking about the work that we're doing at the NMC, introducing additional regulation of advanced practice. What do you think the impact will be, and what kind of opportunities and will that create for the professions in Northern Ireland, but also thinking about the public and also in your role as an employer as well?
I mean, I think when you look at the scope and what advanced nurse practitioners are doing, I think additional regulation is to be welcomed. I do think, again, because for nursing we have the framework within Northern Ireland, nobody can use the title advanced nurse without having completed the advanced practice course. So I think that probably provides the public with a level of
Mm,
assurance. The challenges, I think, are probably around that, and that is because our AHP or our paramedic colleagues in Northern Ireland can use the title of advanced practitioner, but actually they're functioning at a different level from advanced nurses. So if I go back to the conversation I had about the hospital at home, one of the
mm,
conversations was, could one of the roles, if we couldn't get advanced nurse practitioners because we have a 2-year lead in, could we look to the advanced paramedic role? And some of the issues around that was people, again, were looking towards the rest of the UK where advanced care practitioners were paramedics, but they had
mm,
completed that master's level, and that is not the same as our advanced paramedics. They are
mm,
paramedics with additional skills, but not what I would class as advanced practitioners. Another one of the challenges, again, for nursing is one of our requirements is to be able to prescribe, and that is
mm,
not the same for the AHP colleagues. Now,
mm,
um, I don't think that we should not be prescribing. I think it's really important that if you're able to see someone, you see them holistically. But I
mm,
suppose some of the challenge is nearly that two-tier outside of the nursing and midwifery profession, that it may, in ways, give the public a false assurance if they are seeing the level of regulation around advanced nurse practitioners and assuming that all other AHPs or all other advanced practitioners are scrutinised at the same level, which is not necessarily the case.
Yeah, it's really interesting, and it's something that we've been acutely aware of at the NMC through the work that we're doing. Around those things. Our mandate is obviously for nursing and midwifery, but there are some unintended consequences, and it's really important to be aware of that, isn't it? And yeah, particularly challenging for you within your own country and other colleagues across the different countries, to think about how that actually works in practice. And
Yeah,
yeah, you're right. If we're talking about public protection, we do need to make sure that the public understand the role and have their clear expectations around what those individuals can or cannot do. So some really important points there. Do you think that? I suppose, what about in your role as an employer? Is there any more to say about that specifically in terms of, additional regulation and having those clear standards or benchmarks for nurses and midwives?
yeah. I mean, I think that's really important going forward. And one of the lessons that we want to learn is probably from the emergency nurse practitioners in emergency departments years from years ago. So I was
Mm,
around when those were just being created. And again, within Northern Ireland, for us to do that, we had to have our specialist practice in emergency care. Whereas
mm,
I know in other parts of the UK, they were able to do a short course and
mm,
operate at exactly the same level. So
mm.
for me, I think if there is the regulation around that, and I suppose the bit of kudos around the advanced practice title, you shouldn't be getting then that split in ability or qualifications. You should know that what you're getting is exactly what it says on the tin, and it's exactly the same across the board.
Yeah, yeah, absolutely. And you know, we heard throughout all the research that we did, of we've done to this point, that of the huge kind of variation across preparation, which is what you're alluding to, but also roles and responsibilities, but also governance
Yeah.
processes as well. And what we've heard consistently is that, you know, um, acute trusts and what you've described in Northern Ireland is having some robust governance around
Hmm.
advanced practice for nurses at the moment, but perhaps less so we're hearing about in general practice and in primary care, where that still um, needs to be developed. But yeah, I mean, that's the hope, is that regulation, that's why we're doing the work, is that it does bring in that consistency and clarity and reduce that variability.
Yeah, absolutely.
So as you know, we had our principles for advanced practice approved by council at the end of March, and they really we've engaged extensively with stakeholders from across the 4 countries, and you know, some of the complexities of working within frameworks or aligning those principles to frameworks which are very different. So for Northern Ireland, thinking about advanced practice in nursing, but also recognizing that in England, for example, and in Wales, the advanced practice frameworks are multi-professional. So we've developed these principles which kind of set out of our expectations as a professional regulator of what good looks like for individual practitioners, but also for employers and employer
Hmm.
organisations. And again, that's with the aim of where there are not robust governance processes in place, that those expectations will help employers to develop those governance processes in order to kind of protect the public. I wonder if you could think about, or what your thoughts are on how the principles could be implemented across your landscape.
Um, I mean, I think the implementation of the principles may work reasonably well here because everybody's on the same trajectory and on the same foot, if you know what I mean. So we're not looking to maybe the north of England and south of England, and what they're doing is completely
Mm,
different. So all of our advanced nurse practitioners have all followed exactly the same pathway, be they in primary
mm,
care. And I think that there are very, very strong links that are there already. And I think the fact that we have the framework
mm.
within NIPEC, I think that's an ideal place to be able to start really to get those embedded.
Yeah, that's really helpful. It sounds like you're starting from a really strong, you know, a strong place already in Northern Ireland, and you've developed some of this, as I say, that kind of robust and good governance. So you know what good looks like already.
Yeah.
Um, and I guess on a kind of geographical scale, it, it's potentially easier. I don't
Yeah,
know if easy is the right word, but more manageable or easier to do that than somewhere like England, where it's just so vast, and there are different
absolutely.
regions, and there are greater numbers of people and professionals, and all sorts of things which make it a bit more complex. And I suppose it's also about, you know, um, each country has its own system, doesn't it?
Hmm.
So, for example, how NIPEC manages the profession and the requirements is quite robust, isn't it? So,
Yes.
so that potentially helps things. You've talked about some of the challenges with additional regulation. I just wondered, and that's particularly around kind of thinking about the allied health profession workforce and the differences across the countries. Because one of the things that we have been talking about is kind of having this recognition, these standards, so that individuals, if I wanted to come to Northern Ireland to work, for example, there's a standard across the board which individuals have to meet. But
Yeah.
I wonder if there's any other challenges that you foresee, particularly within Northern Ireland, either with the principles or the introduction of additional regulation.
I don't think so. I think because we had specialist practice and that was recorded as an additional qualification, it's kind of anybody who's working within that specialist role or slightly advanced role that maybe wouldn't be a full advanced nurse practitioner have been used to having that standard anyway. And as I say, we're really well guided by NIPEC and the framework. So I don't anticipate, however, it's always one of those things until you try, you don't always know. But I don't anticipate anything that would overly concern me.
Yeah, yeah, and it's really nice to hear that. And the conversation that I had earlier today around Scotland and implementing
Hmm.
the principles within Scotland was a similar thing. Actually, being told that actually we think we're doing this quite well.
Yeah,
But it would be nice to see that, and that's part of the ongoing conversation for us, is that you can have a look at them and see how they feel to you. Do they feel like they work for you within your current framework, and making sure that you let us know
yeah,
whether they do or they don't, and what those future challenges, or what challenges you come across along the way.
yeah, absolutely.
But it's been a really lovely conversation. Simon will tell me off because we've gone over. But really, thank you for your time. It's been
No, my
really, really
pleasure.
interesting, and it's been great to talk to you.
Great,
Simon,
thank you.
over to you.